Leukemia is a type of cancer that originates in the blood-forming tissues, primarily affecting the bone marrow and the lymphatic system. Unlike many other cancers, leukemia does not form solid tumors. Instead, it leads to the uncontrolled production of abnormal white blood cells, which crowd out healthy white and red blood cells. This disruption impairs the body's ability to fight infections and transport oxygen efficiently. The exact causes of leukemia are not fully understood, but both genetic predispositions and environmental factors, such as exposure to radiation or certain chemicals, can increase risk. Its unique behavior among cancers makes leukemia a complex and challenging disease to study and treat. Leukemia is a cancer that primarily affects the bone marrow, the soft tissue inside bones where blood cells are produced. As the disease progresses, it disrupts the normal production of healthy blood cells, leading to a range of symptoms. Individuals with leukemia often experience persistent fatigue due to a shortage of red blood cells, which carry oxygen throughout the body. The reduced number of healthy white blood cells makes patients more susceptible to infections. Abnormal bleeding or frequent bruising can also occur, as leukemia impairs the production of platelets responsible for blood clotting. Additionally, some people may notice shortness of breath or other respiratory issues, which are linked to the body's diminished ability to transport oxygen efficiently. Leukemia arises from a complex interplay of genetic and environmental factors. Genetic mutations can disrupt the normal development of blood cells, leading to uncontrolled growth and the formation of cancerous cells. Environmental exposures, such as radiation, certain chemicals, and some viral infections, have also been linked to an increased risk of developing leukemia. Once these malignant cells emerge, they rapidly multiply and crowd out healthy blood cells in the bone marrow. This disruption impairs the body's ability to fight infections, transport oxygen, and control bleeding. Understanding these causes and mechanisms is crucial for developing effective prevention and treatment strategies. Leukemia is commonly treated using a combination of bone marrow transplantation, chemotherapy, and radiation therapy. Chemotherapy remains the primary approach, using powerful drugs to target and destroy cancerous cells, but it can also affect healthy cells, leading to significant side effects. Radiation therapy is sometimes used to target specific areas, or to prepare the body for a bone marrow transplant. Bone marrow transplantation offers the potential for a cure, especially in younger patients, but it carries risks such as infection and graft versus host disease. Success rates vary depending on the type of leukemia, patient age, and overall health, with acute lymphoblastic leukemia in children having some of the highest cure rates. Despite advances, challenges persist, including relapse, treatment resistance, and managing the long-term effects of therapy. Preventing leukemia involves taking proactive steps to minimize exposure to harmful substances. Avoiding contact with toxic chemicals, such as benzene and certain pesticides, can significantly reduce risk. It's also important to steer clear of radioactive materials whenever possible, as prolonged exposure can damage blood cells and increase vulnerability. Making safer choices in everyday products, like opting for natural cleaning agents and avoiding items with known carcinogens, further supports overall health. By staying informed and cautious about environmental hazards, individuals can help protect themselves and their families from potential leukemia risk factors.